The triple tray is a simplified impression mounting technique for capturing of posterior teeth prepared as abutments for crowns. This technique collects three impression tasks simultaneously. It captures the prepared tooth and its adjacent teeth, it captures the opposing dentition, and finally it captures a bite registration recording of how the dentition articulates. When considering use of a triple tray, it is important to evaluate the patient to see if they can consistently articulate in maximum intercuspation when prepared. This should be assessed clinically prior to attempting this technique. Also, since the triple tray only provides unilateral posterior coverage, the tray is best used when preparing only 1 to 2 posterior teeth at a time, with the understanding that the remaining teeth in the captured impression are enough to dictate the occlusal shape of the final restoration. The impression is taken similar to other PVS impressions, with light body delivered into the sulcus to capture the finish line and around the prepared teeth and other key areas. Heavy body is preloaded to both sides of the impression tray and seated in the mouth. The patient then closes down on the tray fully in maximum intercuspation and waits until the PVS fully sets. To pour up a triple tray, a special quadrant articulator is needed. At UT Dentistry, we are currently using the MonoTrack system. It is important that the hinge components fully snap into the upper and lower components prior to mounting an impression. It is important to visualize the tray positioning over the quad articulator prior to pouring. Often it is necessary to trim back the impression to fit within the articulator, which will also aid in centering the impression over the articulator. Pour the die side first to ensure the abutment tooth is fully centered over the articulator mold. Overfill the triple tray impression, leave a convexity above the tray rim. Then pour up the articulator compartment flush with the compartment. Then invert the impression over the articulator and let it set undisturbed. Once the die pour is set, a second pour is done on the opposing side of the tray. If a crown is to be fabricated on the most distal tooth in the arch, a set screw must be placed and in contact when setting the second pour. After the second pour is set, disassemble articulator by removing any stone preventing the articulator opening and opening the articulator.
The plastic borders on the upper and lower compartments can now be removed to aid in the release of the stone from the articulator. The stone can then be sectioned and trimmed to clarify the preparation's finish line on the die. The articulator mounted casts are now ready for lab submission for fabrication of the final crown restorations.